All right, it is 2 o'clock on Monday, February the 6th, 2023, and I'm going to call to order the meeting of the Safe and Healthy Schools Commission. Sylvia, do you mind taking roll?
Darren Balaam, Zara Darby, Scott Benton,
Present.
Lorraine Benuto, Charlene Bybee,
Here.
Jessica Goicochea, Sarah Porter,
Here.
Rhonda Lawrence,
Here.
Leanne McCauley Larson, Leanne McCauley Larson,
Is our volume in the room maybe not up?
Paige Samples,
Here.
Natalie Sanchez, Misty Von Allen,
Present.
Lieutenant Colonel Scott Caldwell, and Shelley Buchanan. Oh, Mrs. Buchanan will be absent, sorry. Chair.
Thank you. With that, it looks like we have a quorum, so we will continue with our agenda. Item 1.03 is the Pledge of Allegiance. And in honor of National School Counselor Week, I'm going to ask Ms. Loudon to lead us in the pledge. To the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you, Catherine. And Sylvia, it looks like Ms. Sanchez has joined us. All right, we're going to move to item 1.04, which is public comment. Sylvia, do we have any public comment?
We do have public comment from, sorry, Chair. Give me 1 minute, please.
Oh, okay.
Wait to
We're gonna-
for general unless it's for an actual action.
Thank you. We will do those for action items and general public comment in the later afternoon of our meeting. So as the chair, I have been asked to rearrange our agenda to accommodate Dr. Enfield in another meeting that she needs to attend. So I would like to take some things out of order, if that is okay with the commission. I would like to quickly go over 2.01, which is the approval of our minutes, and then take item 2.05, 2.06, then 2.04, if that is okay with the commission.
Chair, this is Liz Flores for the record. If I may, my name was not called during roll,
Okay,
and I'm present.
thank you for that. I appreciate that. So we're going to move to item 2.01, which is the approval of our December 5th, 2022 meeting of the Safe and Healthy Schools Commission. Before we entertain a motion, if there is one, I'm going to ask for public comment.
No public comment.
Thank you very much. With that, I will turn it back to the commission and what the desire of the commission is.
Chair, can you go over again? I'm confused where we're going from 2.01
To 2.05.
to 5, 6, or we just 5 and then going back?
So we're doing 2.05, 2.06, 2.04, and then we'll go to 2.02.
Okay.
Yes.
So you need a motion to approve the order of the agenda, the changed order of the agenda?
No.
Oh,
Okay,
sorry.
I do need a motion for the minutes.
Okay, I'll make a motion to approve the minutes as submitted.
Thank you,
Without
Commissioner Bybee.
corrections or additions.
And Misty Allen, I'll second that motion.
Thank you, Commissioner Allen. Is there any discussion? If not, all those in favor, please signify by saying aye.
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 Any opposed? Motion carries. With that, I would like to invite up Dr. Enfield for item 2.05, possible or discussion and possible action to determine the content, logistics, and marketing of the annual 2023, it says 2022 in our agenda, but it's a 2023 Safety Forum. Welcome.
Thank you. It's good to see all of you. Thank you for accommodating us. We really appreciate it. And I'm going to have Paul LaMarca kick us off, and then we'll enter into some conversation with you, if that's okay.
I have something totally different. Thank you.
Thank you, Dr. Enfield, and thank you, Scott and Commissioners. For the record, Paul LaMarca, Chief Strategies Officer. So I know that in the December meeting, the commission sort of settled on its goals and objectives for the year. And I know in kind of preparing for that, there was some communication about what does the board really expect for us? And she's pulling it up. In helping keep schools safe. And so we really feel like you're on the right track. We're on the right track in doing that. And so we're just going to go through a couple of things. Do we have the clicker?
Paul, I don't want to interrupt you. I need to reread this item. I have two different agendas, so I need to read off of the correct agenda. This is the presentation and discussion of the Safe and Healthy Schools Commissioner's role in providing recommendations to Washoe County School Board of Trustees regarding school safety in the Washoe County School District.
Right.
So I apologize.
Correct.
I read an older agenda that was on my
Okay.
tables. Thank you.
Sylvia, can you go to the next slide? So essentially, kids have to feel a sense of belonging in order to optimize learning. Staff have to feel safe. Families have to feel welcome, and we've talked about this many different times in optimizing school learning. And all these things play a role in the safety, both physical and social emotional safety of our students. Go to the next slide, please. You've had a variety of presentations and conversations around physical safety, things such as single point of entry. Later today, you're going to hear a little bit about some of the safety audits that have occurred in schools. Safe routes to school. We had a presentation on safe routes to school, I believe, at the last meeting, if not the one prior to that. There's a variety of staff in schools that help keep our kids safe. Obviously, school police and school nurses have big roles to play in that, but all staff do as well. There's physical safety teams within buildings that work to make sure our kids are safe. Let's go to the next slide. Same thing with social emotional safety. There are a variety of processes we've talked about, primarily like our MTSS processes, our SEL curriculum. We have school safety teams that focus on emotional health. You guys have had presentations in the past on threat assessments and other practices that take place in our buildings to help keep kids safe. Really, a big part of what we need to push on is engagement efforts. This includes including our families in a variety of different ways.
Can I add something to you?
Absolutely.
The one thing that I would add as well is, and some of you may have saw this, it was in the news last Thursday, that I put out a message to all staff around some of the steps that we're taking in response to concerns we're hearing around safety. And a big portion of that is training. So, we do everything we can from the prevention standpoint, but we know we can't prevent every incident from happening. So we want to really redouble our efforts to invest in our staff's ability to be as prepared as possible to de-escalate, to mitigate those situations before they become something serious. And so I just want to point that out, that there will be coming quite soon, a pretty detailed schedule of when we're providing, and that will be training for all staff. We're not going to make it optional because we think it's that important.
So, Sylvia, please go to the next slide. You get, these are terrible backgrounds.
Yeah, I was going to say, this is impossible to read.
But so you
I'm
know
sorry.
these by heart already, because these are your goals and objectives. You guys established some goals and objectives at the last meeting. You were going to partner with the parent university, you're going to partner with family school partnerships, you're going to look at the catalog of offerings through parent university. You're also going to help us in developing a toolkit that will be used to help families, students know how to keep safe within our schools. What else was one of your goals? Building an understanding between hard measures and soft measures in keeping kids safe, both physical safety measures as well as social emotional safety measures. So for example, the idea of training around de-escalation techniques, that's a perfect example of a softer strategy. It's not a punitive kind of a disciplinary strategy. It's a way to try to calm down an environment and bring back sort of social emotional health in the moment.
And Paul, while you're looking, I'm going to add as well, You know, we talk a lot about the social emotional well-being of our students. We also have to talk about that for our staff. And so Paul and I and Trish are in the process right now of speaking with some national partners to help come in and help us to create a really cohesive strategy for ways that we can provide those supports for our staff members, and opportunities for them to feel strong and ready to face the challenges that we know we're seeing today.
Thank you. One of your goals was to review our training calendars, and so you're going to get an opportunity to look at that. Obviously, you have the annual safety forum that's focused on parents. You're going to discuss that later today. And then we haven't done a lot of this in the last couple of years, but this body will be asked to review policy and practice and make recommendations to the Board of Trustees. So if you can go to the last slide. So I think if we follow and meet our expectations, we have a huge part to play in keeping schools safe. This is a public accountability body, in essence, and part of what is really important for us as staff is to be able to bring things to you in a cyclical manner so that we're on pace, we're keeping pace, we're not leaving things behind, and you help us do that. We will have a board meeting probably in March. That's kind of the expectation at this point. And I think at that time, the Board of Trustees would like to understand where the Safe and Healthy Schools Commission is headed. And I have not had a chance to talk to Mr. Benton about that yet. This just came actually today. But hopefully Scott will be able to represent you. And if not, Natalie can represent you and you'll be able to make comment to the board at that time. You know, with other commissions, they're far more action oriented, and so they've had more opportunity to go to the board because they're making recommendations on actions such as the zoning committee. But we can, at your request, build in time to meet with the board at least once a year so that you can bring forward recommendations, or you can at least comment on safety in schools. So that's kind of that for the presentation.
Well, and also we want to know how we can be good partners for you in this work. So for example, with respect to the safety forum, are there ways that we can help coordinate that, assist in any way? So we also want to make sure that you know that we are here in this work with you, and are happy to do whatever we can to advance your goals and your objectives.
Thank you. With that, I'll turn it over to the commission if there's any questions, comments for Dr. Enfield or Dr. LaMarca? I think it's fair to say that historically the school district has been a good partner for our safety forum. They have been very advantageous in promoting the safety forum, or really helping us find the subject matter experts within the district or within the county. And then those that are on the commission have served as experts, and I'd look at some of those expertise for this forum as well to continue those conversations that we're having. Anything? We're going to let them off the hook that easy? I think it's an important message for you to hear that the school district under Dr. Enfield's leadership is willing to support us, and I think that will help us leverage what we really want in the community, having a voice from her and an ear for us to lend to. So I appreciate that, Dr. Enfield. Yes, Commissioner Allen.
I guess I will just say thank you to both of you. I really appreciated seeing the focus on staff well-being. We cannot have well-being with our students if our adults are not. So thank you so much for that.
Absolutely.
Thank you. Commissioner Bybee.
Thank you, Mr. Chair. I would just like to say, I would echo what Commissioner Von Allen also said. And really, she and I are the originals on this commission. We've been here, it was formed 9 years ago?
Wow.
9 years ago. So we've seen through the years how it's evolved. I really appreciate having our chair and our vice chair go to the board. I don't know that we ever have. You have representatives here that listen to our meetings. You get our minutes. It's kind of not the same as really having our chair or someone from this commission there to really talk about what we are doing, what our needs are, how we work better together. And I really what this commission has done in recent years. We've seen from the governor doing a big study from the audits we had that came out and told us how far ahead we were compared to other school districts. I mean, when there have been some major tragedies in this country, and they came back to what this started 9 years ago, especially with physical safety is where we started. We've evolved into more, everything. We still are ahead of a lot of other school districts. And obviously it never seems to be enough to try to get ahead of keeping our kids and our staff and our schools safe and healthy, and that really is our priority here. But I appreciate the liaison directly to the board and would hope that the board, and sometimes we get board members who come here and they'll make public comment, but that communication more closely so they really see, because what this commission does is super important. And I appreciate your support.
Thank you, Commissioner Bybee. I will you are all welcome to attend the board meeting. I just want to make clear that we may have representation from the chair or vice chair, but you're all welcome to be there. I believe it's March 14th is the date of the board meeting. We'll make sure those invitations get out to you. I also do want to say that you may have heard that we are entering our strategic planning process for the district to sort of lay out our plan for the next 3 to 5 years. And while, we're just beginning and I don't know all of the priorities and goals that we will end up with, I would be shocked if belonging and safety and school culture were not one of our major goals. And so I share that with you because I think that we will soon have a district goal that will very clearly tie in with the work of this commission, and that we can really align the strategies there with the work that the commission is doing. And I think that's incredibly exciting to continue to make sure the lines of communication are as tight as possible. The other thing I do just want to say is I know that there has been a lot of conversation in the community about concerns with respect to school safety. And I want you to hear directly from me, and I want it stated publicly, that I take every incident like that seriously. That we want our staff, our students, our families, everyone to feel safe in our schools, and that we are doing everything we can to make our schools the safe, welcoming places that we want them to be. And it's an ongoing and it's a communal effort, right? It's not something the district can do alone. It's not something this commission can do alone. It's something we have to do in partnership with our staff and students and communities. But I believe that there are some who are portraying what is happening in our schools right now in a way that is not entirely accurate. And so that does not mean that that we don't have serious incidents and we pay attention, but I don't believe that our schools are being depicted in an accurate way right now. And I just needed to say that for the record, because we have extraordinarily dedicated staff, and we have an amazing central office team of people who support our school staff to address incidents when they arise.
Thank you for that. Any more questions or comments from the commission before we move on to item 2.06? Okay, hearing none, we will close item 2.05 and move to item 2.06, which is the presentation and discussion of the Care, Solace, and Synergix programs and the program benefits to support student, social, emotional health, and safety within schools. This is for information and discussion only. I'll turn it back over to you, Dr. Enfield.
Thank you, Mr. Chair. I just want to preface this, and then I will turn it over to Chief Trevino and to Paul as well. But we, as you know, we still have ESSER dollars that allow us to make investments in areas of need that we've identified as the district. And so based on what we've heard from people, based on our own research, we believe that these two investments that we're going to share with you right now are going to go a long way in improving the safety and the access to mental health and emotional supports that our staff and students need.
So thank you again. I'm going to kick it off and then I'll turn it over to Chief Trevino. I'm going to talk just briefly about CareSol, so you can click to the next slide. And I'm using their name only because they're already on the next board agenda. Board of Trustees agenda. We have not selected a vendor yet, but we are using them as an example of what we might be able to bring. So CareSolace is a health service coordinator platform. As you guys know, and we've talked about it a lot, we've had mental health issues, we've had social, emotional kind of well-being issues forever, and we probably always will, but the pandemic really inflamed that. And so we do have folks that are reaching out, trying to get support, and that can be incredibly challenging, especially when you're facing all sorts of barriers, transportation barriers, insurance barriers, different kinds of barriers. Care Solace is that kind of a platform. Basically what it does is it takes the legwork out. As long as there's a referral made, they'll do the work in trying to solidify an opportunity. Sylvia, can you go to the next slide? Basically, all families, all students, all counselors, all schools will have access to this platform. And so if there's an issue that arises, they'll be able to enter information, including a whole host of bits of information that will help the team, the platform team, find the best available resource. And this is primarily an access point for folks that are either uninsured or underinsured. So every effort is made to identify a place where they can be seen within 24 hours. Appointments are made. Families can do things such as choose telehealth versus in-person if transportation, for example, is a barrier. This particular group has been very successful down in Clark County. They've been successful in many locations across the nation. And so we are excited that if they were to come aboard, we really have a community resource for us. You may have questions about Care Solace. We'll get that to a minute. I want to turn it over to Chief Trevino to talk a little bit about this next piece.
Good afternoon, Jason Trevino, Chief of Police. For the record, nice to see you guys today, and thanks for having us. So again, to kind of piggyback off what Paul said, we have not selected a system. We haven't purchased anything as of this point. We're in the research phase right now and looking at a system that would be staff initiated. So we talk a lot about layers of security in the district, and we've always approached security as a layer-based system. This would be a new additional layer to our system that would literally give that opportunity or the possibility for every staff member to be able to contact help if they need it. So what we're looking at is a very simple system that would do just that. It would be something that would say like on a key card that the staff member could wear with their regular ID that they're already wearing for their site or their the building they work in, and it would allow that staff member to summon help with a card that would be added to it. And the system that we're looking at, what we'd like it to do is have a dual function. And dual function meaning it can summon help within the building. So you have a localized emergency, like maybe you have a medical emergency, like you need additional staff members to respond. Or it could be an immediate, I need a law enforcement response. And that one button would do both of those things. So Clark County has a system in place. They actually do have the Centegix software in their district, and hardware for that matter, but the system allows the staff member to summon the help. So what we have currently is oftentimes staff members may be dealing with a situation at the end of a hallway, for instance, which is quite far from the main office. And by the time someone's able to get to a phone or something to summon the main office, the situation has escalated. But if that staff member was immediately able to call for help within the building, people could respond right away. Idea being hopefully be able to de-escalate some situations before they get to a higher level of escalation, which could possibly turn into a physical altercation, those types of things. Just by having more adults present can oftentimes help us de-escalate. The other thing would be that we would have a system that would address our outdoor activities, such as PE, bands, stuff like that when they're out, on the fields and practicing, or during games and sporting events that are occurring outside, baseball, football, soccer, those types of things, that the system would also work outside. Again, adding that layer that we would be able to expand the ability to summon help immediately. Looking for a system that is also a separate and independent layer of the layers we currently have, so it's not interdependent on, like I said, the telephone, right? So if the phones are down at a school, this card system would still work. We wouldn't need the phone system for it to work. The phone, also, it wouldn't be dependent on our 800 megahertz system that our emergency responders use. So again, adding a separate and distinct layer and putting it right in the employee's ability to summon help. I think that covers it pretty much.
So, as I mentioned, the Care Solace piece will be going to the board on February 14th, so next Tuesday, and we'll see if they enable us to enter into contract. I think the staff-initiated system may go very soon thereafter. In both cases, we'll have to solidify the contract. We will be training all of our principals, our counselors, staff members on use, and we go from there. And this is part of Dr. Enfield's plan that she talked about last Thursday night.
Commissioner Bybee.
So explain how the alert system works. Is it when you press it, I think of the senior safety alert when you've fallen and it just sounds an alarm, or is it connected to that teacher being able to verbally tell somebody what's going on and what they need? How does that integrate from what the button they're pushing to communications and through what system? Just, I wasn't sure.
I think I follow you. So basically what happens is if you press the button 3 times, it summons local help. If you continuously press the button, it'll bypass the local help and go to our dispatch center. So it's a very tactile button. It's not something you can bump easily and set it off. It's very distinct. And then the button, the card actually vibrates to give you immediate feedback that it has been initiated. As part of the system, I'm looking to see if we have one in here. I think it's just outside, but as you walk around our building, you'll see in the hallways we'll have little beacon lights, and they'll see like there's a clear light and a yellow light. It will be a similar system to that as well that'll be installed throughout the building. And when that system is initiated, depending on if it's a localized alert or summoning emergency medical response, it'll flash a different color. So as part of that, and you're probably wondering, well, how does that get me help if all it does is set off an alarm? It'll actually pinpoint the location of the card within 15 feet. And that would be sent, if it's localized, it would go to the front office where staff would be monitoring the system. And if it goes to our dispatch will be able to monitor that as well. So if, for instance, I'm out on the football field and all of a sudden there's a problem, I see, worst case scenario happening, I can continuously press the button, it's going to summon law enforcement. Our dispatch is going to see that summons is coming from the football field. If you have a problem that continues to move, which is a cool feature of the system, if you set your system off in the football field and then Dr. Infield's closer to the building, now the problem's coming towards her, she initiates her button there, it'll continuously track that as well. So if we have a problem that's moving from outside to inside and people are initiating their button, it'll also give us that feedback that the problem is moving into the school or away from the school as well. So it's accurate to within about 15 feet. The great part about it as well is it is not dependent on one site location. So if I have my card, it knows it's me, obviously, it's registered to me, but if I leave the central office building here and I drive over to Spanish Springs High School, the moment I get within that geofence that's built around Spanish Springs High School, it now recognizes that my card is active again in that geofield. So if I'm on the freeway and I press the button, nothing's going to happen. If I'm in my house and I press the button, nothing's going to happen. It has to be within a geofence. So the company will actually build all the geofences for all of our sites. So that's how you would get the help. So the one thing is it doesn't have audio communication, but it basically tells us we need to get there right now. Yeah. And then obviously our dispatch will be following up, if we have, cameras and things like that, they can be looking on the cameras to see what kind of problem that we might be going into. But the idea here is to summon immediate help, whether it's an internal problem or a bigger emergency responder problem versus trying to get to a phone, the radio, those types of things.
Thank you. I'm going to throw it over to Commissioner Lawrence and then to Commissioner Porter.
This is Commissioner Lawrence, and I have a question about Solace Care. I'm really curious, or Care Solace, I'm very curious about how they build their network of providers, considering that I am struggling to find licensed Nevada MFT, marriage and family therapist, certified professional counselors, licensed alcohol and drug counselors, psychologists. I just am kind of curious as how they build their community of care providers that are actually qualified and trained. And I will just tell you, I just had an experience of looking at the state's employee assistance program and the list that I got, and every person called had a wait list. And I know if I'm having that problem, and I do have some, understanding of the system, especially for children and families, I just am very curious about a program that can promise something so amazing, which if they can, really provide that would be very amazing, and I would want to learn from them about how they're doing this.
Thank you for the question. I think it's a really important question, and actually we've asked it as well. And so we're curious about it. The system is built to an extent on knowing that some of our resources are disorganized. In other words, we don't know where everything is. So they put extreme effort into building this resource directory. They've already given us examples. As you know, the Children's Cabinet, through a partnership, I think you know about this, a partnership with Renown and the Office of Suicide Prevention and Washington County School District, was trying to develop a resource. Others have tried to develop resources. At the most recent safety forum, there was a new resource put together. And the problem with those is they're good that day, and then by the next day something has changed. This group has dedicated staff that are constantly just building and working on the resource itself. They have a great track record, and I'll turn it over to Dr. Enfield to comment further.
Yeah, no, Commissioner Lawrence, I really appreciate the question. When we brought them in to sort of start talking with them, we actually had the Children's Cabinet and Renown and some other folks in the community, because there's an interest, I think, in this extending beyond the school district and making this a countywide resource. No system is perfect, and you are right to point out that there likely will be some shortcomings or limitations. However, I think to Paul's point, the advantage they bring is dedicated resources to keep the database updated. And we will carefully monitor it in partnership with you all and others in the community. And if we see missed opportunities, or if we see inaccurate information, we will address that immediately. But we're very optimistic that this will go a long way in reducing barriers to access that many in our community have.
Let me comment on a couple things they do as well, which they're hopeful. If I'm a parent, or if I'm a counselor at a school and I send in a referral for Paul, and I don't have the ability to sort of navigate the system, I will be connected with what's called I think it's called a care liaison, or a chaperone, essentially. That person is in charge of finding all the possible resources based on a series of questions that I answer. For example, if I want a particular type of a therapist because of my cultural background, that's what they're going to search for, which is going to make our problem even harder. But they also do a kind of an interesting thing that I think might matter. They will regularly publish out to the community via their website and through internal communications who's helping and who really hasn't been helping. So they'll put out their top 10 of providers. So I think they might create a bit of a competition that could be healthy for our families.
I think can I just say too, I think there's also an opportunity for us to see where we have gaps within our community around services. I think that could be even more powerful than providing the services themselves. So.
This is Commissioner Lawrence again. Thank you for those comments. I think those are really prescient. And I do think about wanting to address people's linguistic and cultural needs in mental health. I think that is something that I struggle with greatly just within the Division of Child and Family Services. I'm also a voting member of the Washoe County Children's Mental Health Consortium, which Children's Cabinet, is the chair, Jacqueline Klein-Nedler, and Miss Yvonne Allen, Commissioner Yvonne Allen, is part of that as well. And we have struggled for a long time to try to find some kind of centralized network. And so the idea that there would be resources that would be ongoing to keep up, because your remark about you get a list, it's a point in time list. It's not a living, breathing list. So you have to really keep that going. And then the other thing I would just say is that, myself and the division is just really, really motivated and working all the time. It's probably my third job is mental health workforce development. And especially in these specialty areas, my specialty area, which is infant and early childhood mental health, and kind of the work that we're doing in the state around an association and kind of building that workforce. But yeah, I think this is really very, very important. Our clinic is a main training ground for the MFT and CPC program at UNR, and the more that we can do to kind of, I think, get that centralized system of network would be very, very helpful. I do like what you're saying too, Dr. Lamarca, that they would kind of have a top 10. I think that could be very, very helpful. So thank you.
It will also provide, in addition, Commissioner Lawrence, it will also provide us with what the sort of the top areas of need that people have been accessing. And I think that's going to be incredibly informative for us as well.
This is Commissioner Lawrence again. I think there have been, and I'm looking at Commissioner Von Allen, there have been so many gap analyses that have been done in our state. And actually there's kind of a map of gap analyses that have been done. I'm working on one right now in infant and early childhood mental health. So I think to have that in real time is actually would be very helpful, I think. And it would really drive maybe, like, we want to make data-driven decisions, right? Well, this would be really important information to kind of drive, like, the mental health workforce training programs And I'm actually thinking about training programs that go after you graduate from from master's level programs, because those are generalist programs. When we're talking about things like eye movement desensitization and reprogramming, reprocessing, EMDR, which is like one of the evidence-based practices for trauma, that's a practice that I would want to see in that network pretty widely held, because I think that that's a really good treatment that has a lot of great evidence behind it, but I don't know who those providers are. So to have that kind of subsection and to see if there's a need there, then the state could partner and possibly bring in those trainings. So there's a lot of opportunities here.
Well, and clearly we're going to really rely on the expertise of people like you once we move forward with this. And I have no problem going back to the leadership at CareSolis if we see gaps, if we see ways that the system could be improved. I think they would welcome that. And so I also don't want us to think that we just have to take it as is. If as we learn and we get smarter, we realize there are things they could do that would really help us advance in this work, they would be open to that.
Thank you. I'm going to send it over to Commissioner Porter and then Vice Chair Sanchez.
Great, thank you. Commissioner Porter for the record. I had a very similar question, so thank you for asking that. But to piggyback on that, because of the wait list, and you said it was for underserved communities, so people without insurance or underinsured people in our community, what about people who do have insurance or are willing to cash pay but don't have, it's such an urgent issue they can't be on a wait list for a mental health facility or a practitioner?
The system is for everyone, but it uniquely serves the needs of some folks that have been underinsured or they're Medicaid eligible, they just don't know where to go. They will search that information out in kind of the query process, and so if a person is insured, they will find people that take that insurance. If they're cash pay but they don't want to use their insurance, they can make those very customized requests.
Commissioner Porter, could I also add, I'm glad that you brought that up, because I do think it's important that we not minimize the human factor here. And what I hear you saying is in a real issue of urgency, and a particular individual does have the means to how can we connect them? I really think that's where still going to a principal or a counselor or someone here at central office say we need help immediately, right? And we can help facilitate that. There's always going to be a need for that moving forward.
And I just want to clarify, so the CareSolis and Centrix are two different systems, correct? And CareSolis is all for mental health and support, whereas Centrix is more for immediate need. Also, I hear you on if there was an escalation issue, but you mentioned football and being in sports. Is it also if someone gets severely injured on a field to get medical help out there too? Is it serve that role as well?
Yeah, absolutely. And Clark County has a system in place now. They're using it. They've been using it this school year. They demoed it last year. Absolutely. The majority of the time, it's going to be used for non-physical emergencies based on the evidence that we've seen in other districts. So, medical emergency, someone's choking on an apple in the cafeteria, things like that, or something of that nature. That's going to be the bread and butter of the system. But it's also going to be there if you have the worst case scenario, that we always hope doesn't happen. It'll address that as well. But certainly, it'll be used more often than not for your average day-to-day in-house emergencies is how we refer to them as.
Last question I have on that then, is this K through 12 that would have these, or is it just high school, middle school?
This will actually be district-wide, so K through 12, and then our the building here, like Paul's building. So all of our employees that they're building, that their workspace that they're in would have that ability. Yeah.
Vice Chair Sanchez. Hold on, Natalie, we can't hear you. We're gonna, tech support's helping us.
Can you try that? Try that.
No, we can't hear you yet. Natalie, do you want to type it in the chat and I can ask? Or we could have Sylvia read it in. And while she's doing that, I have a question around the Centrix. Are the bus drivers included in this? And if so, how, if they have to pull over on the side of the road, will that information be relayed?
Yeah, so it's a very unique question. So yes, the bus drivers would have it, but their bus wouldn't be a geofence. So if the bus is within one of our geofences, absolutely. Once the bus travels outside of that geofence, the card wouldn't work. But our buses have the 800 megahertz radio system to dispatch, and they can summon help that way directly.
Thank you.
She's typing.
We're going to go over to Commissioner Von Allen.
Yeah, thank you. Is there an example of the Clark County network of providers that we can dabble in? I've, in the past, worked on building resource directories, so I know the challenges, but I'd love to see what that looks like, if possible.
I'll ask the question to see if we could get access to that. They did show it to us, and I think they launched in August, and at the time when we got the first presentation, they'd had like 30,000 hits on the system. They had I think it was around 4,000 that were like pursued hits, where they got in touch with this care chaperone. And from that 4,000, I think somewhere around 2,000 people had appointments within 24 hours. And those were the people that continued to persist to get an appointment. So it was pretty successful there.
And I would add too, I think we would be more than happy once we've moved forward to bring back, once the system is up and running for a few months, to come back and give a presentation to the commission about how it's working, take questions, see if there are ways that we need to be doing things differently. But we'd be happy to do that later in the spring.
Thank you.
We now have the comment. So Vice Chair Natalie Sanchez is saying, hello, thank you for the presentation. Very interesting. I'm curious about Care Solace. Does it serve as both a hub and do they provide clinicians? Additionally, do they collaborate with local providers, or are they all within their own network?
So they are a hub, they do not have their own clinicians, and they are definitely going to partner with all of the clinicians in the Washoe County area and then beyond, because some folks will be very good with telehealth, and so they may be able to access providers outside of the county. That's my understanding.
Thank you. Any other questions or comments from the commission? Sylvia, are there any other hands that I'm not seeing besides?
No other comments. Vice Natalie Sanchez says thank you.
Thank you. All right, with that, we will close item 2.06 and move to item 2.04, which is discussion of the chronic absenteeism parent information campaign, including a discussion of the efforts of trauma on students and the mental health stigma. Turn it back over to you, Dr. LaMarca.
Thank you, Chair Benton. Members of the Commission, for the record, Paul LaMarca, Chief Strategies Officer. We wanted to bring this item back to you, and it actually ended up fitting really well with sort of these added items. These items came late because of some need. At the December meeting, again, you guys, as part of your goal statements, wanted to partner with the parent university. We've started working with the parent university, Delisa Crane, and that group is Delisa here? Yes, Delisa is here, good. And Rochelle Murillo. And we're in the beginning stages of launching this chronic absenteeism campaign. It might not be called a campaign in the end, but at this point it's a campaign. And what we've provided for you is just a draft document. And really what it does is it just gives you some of the principles that we're shooting at, some of the key messaging, and then it talks a little bit about our audiences that we would be targeting and some of the offerings that might be provided. Now, I want to urge you that what's in the matrix itself is very draft. It's going to change, but I want you to know that we're making progress, and we intend to bring this back to you regularly because it's part of your goal structure now, so that you can weigh in and you can modify these things. Another point I want to make with this is, if you remember at our last meeting, we talked about associations between attendance and behavior, between attendance and academics, behavior and academics, mental health. These things don't live in silos. So when we go out to talk with folks about absenteeism, we're going to use that as an opportunity to talk about all of these issues. If we're out talking about attendance, we may focus more on that than the other areas, but we will always seek to draw connections between them, okay? Attendance is a huge issue, and there's a lot of debate because at this point, you guys have heard of chronic absenteeism. And the basic definition, this comes from the federal government, is if a student attends less than 90% of the time, they are deemed chronically absent. If they attend less than 80% of the time, they're deemed severely chronically absent. And we have high rates of chronic absenteeism. You saw that at our last meeting. It's not just the mere fact of showing up to school that's important. It's being in front of a high quality teacher. So some of the issues that get debated are, well, should this absence count toward that chronic absenteeism definition? Because I'm excusing this absence. My son was at a doctor. Well, the answer is yes, because they went to a doctor, but they still missed critical instruction. So that's why these thresholds are in place. That's not to say that we shouldn't take kids to the doctor, but it is the debates around what should be excused and what shouldn't be excused really don't kind of matter, you know, in a sense, because what matters is high quality instruction. And so that's the kind of information that we have to help parents understand, because we do believe that some parents think that under certain circumstances it's okay to be gone, and in others it's not. Again, when there's safety issues, when there's health issues, kids need to stay home. But the fact that you're missing instruction is a critical issue. There's some really good research that we're kind of pinning this to. It comes from a group called Attendance Work, or they've compiled the work. Compelling data. If you are chronically absent in kindergarten, you're significantly lower in performance in grade 5. And this is across the nation. These gaps persist. Sixth grade is a pivotal year. If you're chronically absent in sixth grade, your probability of graduating from high school declines precipitously. And it's even worse if, as part of that, you also fail a reading class or a math class. So there's pivotal years where attendance is particularly important, but it's particularly important every school year. In terms of some key messaging, one of the things that I think happens, it happened to me as a parent, we tend to think that our kids are resilient, and they are, and thank God they're resilient, but they're resilient because they have support networks around them. We can't rely on resilience. We can't just assume a kid's going to be okay, they're going to make it up, they'll be fine. But I do think at younger grade levels in particular, oftentimes people just make the assumption, oh, it's okay if they miss. You know, it's better to do this than to go to school. Gaps become bigger over time, and kids don't know how to articulate that. So another key message is that attendance and behavior, but attendance, what it is it's a signal of disengagement. So it's not, attendance in and of itself is not the problem. The problem is its relationships. Kids rarely just don't attend because they don't want to attend. There's usually other things going on. So it's a critical signal for us as a system to look deeper, to identify root causes, to use strategies to help kids get access to education, and to help parents understand just how important it is for regular attendance, especially at the early grade levels. So I'm kind of going on and on. I do want you to know that in terms of this campaign, at least initially, and I talked to Rochelle today. I wasn't able to talk to Delisa today. She's already reviewed this as well. She put most of it together. There are other constituency groups, but right now we've got listed at least 3 groups, and that's parents, teachers, and other educators, as well as community partners. Attendance education is a community issue. It's not a public school issue. It's a community issue. The vibrancy of our community is dependent on kids in schools. And so all 3 of these groups are critical constituencies. And then, as I noted, there's some draft ideas of some of the things that will be offered to these different groups. You all have an opportunity to weigh in on this. Hopefully some of you with your expertise may even be able to help present some of this, and we do have several community partnerships already that we will work to our advantage in bringing this to our families. So Scott, that's really all I had to share about this. I just wanted you guys to be aware that we're making progress relative to your goals.
Thank you for sharing. Commissioner Porter?
Commissioner Porter, for the record, do you have something we're supposed to be looking at, Dr. LaMarca? You
Yes,
keep
it was
referencing it, and
provided.
I don't have it in this packet.
We'll get it out to you.
Okay, great. Just want to make sure we don't lose that. Thank you.
Chair.
Yes, Commissioner Lawrence. I was looking in our email to see if it was sent through email. I don't have it either.
All right, that's on me, and I apologize. It should have gone out to you guys last week. We will get it out to you. I pretty much said what was in the first page of it, but then you can look at the rest of it. Sorry about that.
Thank you. Commissioner Lawrence?
This is Commissioner Lawrence again for the record. I have some experience of supporting some youth that were attending school or having difficulty attending school actually due to a mental health diagnoses. And so I think that part of that's here in the agenda that talks about the destigmatization of mental health and kind of building more understanding of that a severe major depression is a severe illness and that it's a pretty hard illness to overcome by just kind of willpower. And unfortunately, that was kind of some messaging that this young person received, and it was sad for me and disappointing, and it just kind of always leads me to where we have some opportunities, I think, to really try to not just educate or train, because I feel like that's very superficial, but to really help people gain understanding through relationships that we can have as a community. And so I'm a community partner that is very, very interested in engaging with any adults that are in our public schools and really understanding more fundamentally what it means to experience a major, any kind of mental health diagnoses, that these are real diagnoses. They're as real as a child who has asthma or a child who has diabetes or any other kind of medical issue.
Thank you for the comment. I think it's a great example of why this is critical. As you all know, because we've brought that to you, we have attempted to bring in co-located services to our buildings. We have more and more embedded mental health supports within some of our buildings. And really, though, what you're getting at is through our SARB process, our Student Advisory Review Board process, it's hearings for when kids are absent significantly, as well as our behavioral hearings. 9 out of 10 times what we identify are their family stressors. Oftentimes that can include mental health issues. And so what we need to do is get at that root cause, address the root cause, and at the same time get the child access to education, because long-term education is going to be the most important protective factor. So that's why we think that one of the constituent groups that we must reach are our community partners. We've got to bring more resource into our schools to support these kids.
One more comment?
Yes, Commissioner Lawrence.
I couldn't agree more, and this really kind of dovetails earlier with what you were talking about of really supporting teachers and everyone that's working in our schools, because there are those people who are the primary engagers, right, with children and families. So I appreciate that point too. So that's just a comment.
Thank you. Commissioner Porter?
Commissioner Porter, for the record, I have another question around how you're counting absentee. Because you mentioned even if you have an appointment or kids comes out of school for an appointment, in my mind as a parent, a full day missed versus at the last hour of school because they have a doctor's appointment is very different. So how are you weighting that?
This is exactly when I wish there was someone in the audience who isn't in the audience. But the way we do that, I don't believe Mr. Taylor is here. No. So if a child just missed one class period, in terms of a chronic absenteeism issue, that wouldn't show up as being chronically absent. But if they missed the majority of the day, it would. So it's really based on the number of periods in a day, at least at the secondary level. But what I would suggest is it still matters. So if that last hour is the hour of the week in which they focus on social studies, and a child repetitively misses that, they're going to create a gap. Now, the way I worded that earlier probably sounded quite callous. If my child is sick, I'm going to keep them home. If my child needs to go to the dentist, I'm going to try to get a dental appointment so they don't miss instruction. But if they have to have a dental appointment, they're going to have a dental appointment. So the point of the excused versus non-excused is essentially up to 10%, it doesn't matter. But once it hits 10%, the point of it is that a gap is being created, and there could be problems later.
Thank you. Any other commissioner comments? Anything in our teams?
No, Chair.
Thank you. With that, we'll close item 2.04. Thank you, Dr. Lamarca. And go back to item 2.02, which is a presentation and discussion on the Be Smart framework, a program designed to help parents normalize conversations about gun safety, including preventative actions. I'm going to invite Kristen Swagman, Jean Gage, and Melissa Olson.
Thank you. Hi, I'm Kirsten Swagman. I'm a Be Smart volunteer, and I just want to thank you all for inviting us to be here today. For those of you that have been on the commission for some period of time, Be Smart might seem familiar. Volunteers from our group did share some Be Smart information with this body in 2019. I know in the 4 years since, anyone thinking about health and safety in schools has had a lot on their plates, so we're just really appreciative to you for inviting us back.
Thank you for being here.
So if you want to go to the next slide, before I hand it over to my colleagues to talk a little bit about the substance of the Be Smart program, I just wanted to share some high-level context about who we are and what we're trying to accomplish in Be Smart. So Be Smart is first and foremost a public education and awareness campaign. We are not political. We are not policy oriented at Be Smart. We really have two main goals. The first is to raise awareness around the life-saving importance of secure firearm storage. And the second is to create space for adults to have conversations about gun safety. We know that those conversations can be tricky. Guns are a sensitive issue. They can be an emotional issue for many people. So we're trying to create some space and provide some resources that parents and other caregivers can use to have those conversations. Be Smart is a research-based program. All of the information that we're going to share with you today comes from research, generally out of the field of public health, medical research. There's some law enforcement data that we're going to share. We're always happy to provide sources to the information that we are sharing with you. It's also available on our website. And that research foundation really gives us a lot of confidence that the information we're sharing is grounded in data and is an effective way to reduce injury and death. And then finally, Be Smart is for adults. We think it's great to talk to kids about guns and gun safety. There are lots of great programs out there that do that, and I included a handout in the information that we shared with you that does have some resources for talking to kids about guns. But our stance at Be Smart is that it is the responsibility of adults to create safe environments for children to be in, and that's why we're focused on education for adults and conversation among adults.
See if I did that right. Good afternoon. I'm Melissa Olson, and I've got 3 statements to bring us together. We all believe, or we all want kids to grow up happy and healthy, and we all have a right to decide, make responsible decisions about how best to keep our families and our homes and our communities safe, and that includes whether or not to have a gun in the home. And lastly, if we can prevent even one child gun death or injury, it's our responsibility to do so. But as my friend Kirsten said, we're not here to talk about laws or policies, so we're just going to set that all aside for now. I'm a retired educator, and my passion and my focus was always on the well-being of my students. And secure storage impacts student safety in 2 ways. First, secure storage can prevent guns from being brought to schools. 3/4 of school shooters acquired their guns from the home of a parent or a close relative, according to Secret Service data. Locally, the RGJ reports that there were 16 incidences of a gun on campus in the 21-22 school year. 3 of those were at high school, 10 were at middle school, and 3 were at elementary school. Another area that we should consider when we're talking about student safety, is the idea of self-harm. Access to a firearm can mean the difference between life and death when it comes to a young person in crisis. 90% of suicide attempts involving a firearm result in death. That's a much higher fatality rate than any other means of self-harm. In a CDC annual youth survey, 20% of high school students reported seriously considering suicide in the last year. And in another study, 41% of adolescents in gun-owning households reported having easy access to the guns in their home. That's especially concerning when you consider that over 80% of child gun suicides involve a firearm taken from a family member. So those are staggering numbers. However, research shows that responsible gun storage practices, which include storing household guns locked, unloaded, or separate from ammunition, are associated with a reduced rate of child gun suicide. And one study showed that in households that locked guns and ammunition, there was a 78% lower risk of self-inflicted gun injury in children and teenagers. So we have talked about why secure storage is important, and now my friend Jean will talk about an overview of the presentation from BSmart.
Thank you. We're on thank you. We're on this handout, just for your reference. And I'm going to address the green rectangle. As you can see on your handout, SMART is an acronym, so I'll be covering the letters in that. Now, typically our audience for BSmart are parents and other adults, and we have 20 minutes for just this piece of the presentation, so we're going to do an abbreviated example of what the letters are, but I feel you'll get a good sense of what our parents would hear in a workshop. So you can see on the handout then that S is to secure your guns, whether it's in your homes or your vehicles, and hiding a gun doesn't mean that you're securing it right out of the gate. 13 million households in our country with children have at least one gun, and a third of those are unlocked and loaded. A third of the guns in 13 million homes. A gun should always be stored securely, and Melissa was talking about, what secure means. It means that kids don't have accessibility to those guns in order to keep them safe. And we want to make sure that our children are never in the presence of an unsecured gun. Again, in your home and in your car. I borrowed a car recently, and when I was looking for the garage door opener, I found a loaded pistol in the glove box. And this is a family with young children. So, to be sure, when I returned the car, we had a conversation about my work with BSmart and, the tragedies that we hear about that can 100% be avoided, right, if these children don't have access to these guns. All right, and under the seat, that's not secure either, but certainly not in the glove box. M is for modeling responsible behavior. So every law-abiding citizen, as we've said, has the right to decide if they want to have a gun. That's fine, but you cannot rely on curious kids not to find that weapon. So the third letter then is A, and that means we need to ask people. So when our children go into other people's homes, it's real common to talk about the timing of the visit. Do you have a swimming pool? Do you have pets? Is your child allergic to something in the home? And we need to include in that conversation, do you have guns in your home? And if you do, are they stored securely? Okay. Just add that to the conversation. When I was raising my children, I never asked that question. But to be sure, as a grandma, that's part of my conversation now. All right, then R is for the responsibility, recognizing the role of guns in suicide. And Melissa was talking about some of those statistics. If you have access to a gun, it's likely that the suicide attempt will result in death. So we want to avoid that. 41% of child suicides involve a gun. And then as our children get older, wiser, I don't know, we need to take a look at how we're storing our guns Maybe we've always had maybe a cable lock on the guns. Well, they get more resourceful and more creative, so maybe it's time that we step up our game and buy a gun safe, right? Again, safety is the number one concern. And then the T is the most powerful part, really, and that is to tell people. Go out and spread the message about Be Smart. When we're doing the presentation in front of the parents and other adults, we always end the presentation with saying, you know, how are you going to commit to Be Smart today? What methods will you use? How many people? Can you go and commit to telling 3 people, right? So that we get them to think about it at the moment. And in fact, we even do some role playing as far as that goes. So that's the abbreviated version of SMART, and I'm going to hand it back to Kirsten to wrap up for today.
Thanks, Jean. So I wanted to just share with you a little bit about the work that we've done thus far in Northern Nevada, kind of leaning into that T and tell how we're sharing the Be Smart message. So probably the most common way that we share Be Smart is through tabling events. We'll host a table at different community events or in partnership with some of the community partners that we've affiliated with. And that's just a space for us to hand out literature, to have conversations with gun owners and non-gun owners alike about gun safety. We try whenever we can to have free gun locks that we can hand out at those events as well. In the past, we've partnered with the Reno Police Department. They were supportive of this work when we met with them in 2019. We were able to host a table at their community symposium on immigration. And this spring, we're looking forward to being present at the Washoe County Sheriff's Office Resource Fair. Thankful to Sheriff Balaam for his invitation to attend that event and his support of Be Smart. We also have this 20-minute presentation that Jean mentioned. We're happy to share that with any audience that would like to see it. Some of the places we've shared that presentation in the past include UNR Med. One of our volunteers was a pediatric faculty member there. She shared Be Smart with her students. We recorded a version of this presentation and worked with the Clark County Division of Children and Family Services to upload that onto an online platform they have for foster parent training. And just recently, we also were able to present Be Smart to Safe Kids Washoe County, which is a coalition of medical providers and other community folks working out of Renown Children's Hospital, and we're looking forward to continuing to work with them on this project as well. Nationwide, 8.5 million kids live in a school district that educates parents in some way or another about the importance of secure firearm storage. That does include children and families in Clark County School District. They passed a secure storage resolution in June of 2021. That 8.5 million number has quadrupled over the past year or since the end of 2021. So I think we're really seeing a lot of momentum around school districts recognizing that it is really important that they engage on this topic of secure storage. So we're here today to kind of ask for your consideration. We think that if this commission and if the school district is supportive of a partnership with Be Smart, there are some great existing avenues that we could work within to share this information. We've certainly thought about Parents University. We know that the district has a well-attended back to school fair in the summer. We're familiar with some of the work that the family and community engagement facilitators are doing in the school district. But really, we're just, we're open to any kind of discussion about how you think we might effectively partner. And we're happy to answer any questions that you all have about the Be Smart program.
Thank you. I will turn it over to Commissioner Flores.
Sound
She
like
was
me
leaning
here.
in first.
All right. He's learned to read body language. Hello, Commissioner Liz Flores, for the record. Thank you so much for this presentation. A comment and a question. The comment is that I know last year at our safety forum we had a component related to suicide prevention, and there was a firearm safety piece related to that presentation because this body recognized the correlation between suicide and firearms. And so I very much, I believe this message resonates with this group, so thank you very much. The question I had is related to, you mentioned the gun safes and that sometimes you're able to provide that. Is there a funding issue related to that ability, or how do you determine when you provide those to people seeking information and support? Thank you.
Yeah. Just a point of clarification, what we're able to provide is the cable locks, which are much less expensive and easier to get around as well than a gun safe. And when we have funding available to provide those, we give them to anyone who would like to have one.
Did you want to? But we do provide information about the range of the different options, gun safes, gun locks, and so forth. But yeah, unfortunately, we don't have the funding at this point to give away gun safes. That's an awesome idea, though.
Commissioner Von Allen.
Thank you so much for your presentation. Misty Allen, Office of Suicide, for the record, and grateful for all you do. We cannot speak about this enough. So I encourage you to work with Division of Child and Family Services. They have the Child Fatality Review, who does have funding, and the Office of Suicide Prevention provides gun safes and locks with mobile crisis partnerships. I am every March, April, the funding goes out, so I encourage you to look for that and stay in communication. And also the Northern Nevada Public Health, which is the health district, is looking at a new initiative for lethal means safety. So any way we can support your work, it's a great model, and I appreciate the work you do.
Thank you.
Commissioner Porter.
Commissioner Porter, for the record, hi. Thank you for your presentation. I have a few questions. Helpful in how the message is spread, and it sounds like you have not partnered with the school district to date. Correct, so this would be brand new. I love the things that you asked for in terms of where you'd like to show up. As a next step, would we need to come back to you with, we would love to invite you to these things, or I want to make sure we don't get lost with that. So is that something we can take offline?
Yeah, I think it's a conversation worth having where we can fit you in and how we as a commission can support you, I think is what you're seeking today. And from hearing from the commission, you have our support. It's just trying to find maybe within the different backgrounds that we bring to the dais and how we can support you in those different roles.
Yeah, absolutely. So I want to make sure that we don't lose that in this meeting, whether that's with Dr. LaMarca or us as a commission, that we make sure you're invited to those types of events. Have you ever been able to partner with gun sellers to where you can actually have like pamphlets, information, and that kind of thing? Has that been receptive?
We spent about 4 hours in the gun department of Shields. That was very enlightening. Especially if you're not used to being around guns. And I was so surprised, pleasantly surprised. People were 99% behind us. The parents would come up and talk about, of course, some of them are packing. Some concealed and some, on their holster or whatever. But they were absolutely behind this. So we just need to get to the people who aren't really aware at this point about gun storage, safe gun storage. So gun dealers, we got to be in Shields just because we know some people that are there. But we're willing to, like Kirsten was saying, we're willing to table wherever people will listen. Absolutely. Yeah.
And on these forums where you have in the tables and that kind of thing, and you're talking with adults, do you have kind of tools for adults that maybe, what's the pushback they get when they go to a home and say, do you have guns in the house? What's kind of that pushback that they would get, and how could they handle that? Do you have any of those kind of if-then statements that you include in your training?
That's actually part of the role playing that we do, yeah, because they are kind of awkward conversations. We have an out, well, try texting, non-confrontational. So, but the more you talk about it, the easier it is, really. So yeah, we do talk about that. And the more experience we have in doing these presentations, the more examples we have of pushback, and then we have, a list of responses. Okay. So, but it's really amazing how little pushback there is. I think if we educate people properly, because nobody wants their children to be heard, if we educate them, we'll be more successful.
Okay, thank you.
Yeah.
Commissioner Samples.
Hi, Peg Samples for the record. Thank you so much for the presentation. I was also wondering about going to gun dealers, but also having just taken the class to renew my own CCW, have you kind of had a conversation with anybody that gives CCW classes to be part of that presentation? I think you'd reach a huge range of gun owners and responsible gun owners. Yeah. So I think that might be an idea as well.
That's an excellent idea. Melissa Olson, for the record. I've also completed a CCW, although it is lapsed at this point, and I'm struck that I hadn't thought of that before. So thank you for that idea.
Yeah, and it sounds like you've had conversations with Sheriff Balaam. I think, I might be wrong, but I think Sheriff Balaam is one of the entities that's in charge of setting the CCW standards pursuant to statutes, what has to be taught at CCW classes. So it might be where some more ongoing conversations to get more of the Be Smart curriculum intertwined with the CCW classes. Yeah. The other thing is, have you heard of the Biggest Little Easter Egg Hunt? This is the second year that it's going on. It's April 1st, and it sounds like you'd be great to have a table there. I can email the Be Smart Reno at Gmail address to give you information.
Thank you. Commissioner Bybee.
Charlene Bybee for the record. As we're just kind of brainstorming, where could you go and what, messaging? Have you worked with any organizations like Rotary, Seroptimist, Junior League, that are all going to be adults, some grandparents like me, some parents who have monthly meetings are looking for. Junior League is very involved with women and children, and this would be like right up their alley of wanting to be informed about this, but Rotary I'm familiar with also. And then how about groups like Forever 14, which is suicide awareness, and obviously some of those families that have, met under unfortunate circumstances, but are really pushing hard for suicide awareness. But that messaging, obviously, for their audience is personal and kind of, how far out. And PTA, I don't know if they have to be within the Washington County School District before you could do any parent-teacher organizations. That probably is what has to happen there. But other organizations where you've got adults that are meeting that would be receptive, I think, for sure.
Commissioner Flores.
Commissioner Flores, for the record, one more question. This little infographic is really, I think, well done and clearly articulates, and the acronym is really helpful. Do you have something in Spanish?
Yeah, we do. I don't have Spanish language versions of those cards with me, but everything that we have available in English and in Spanish.
Thank you.
Yes, Commissioner Samples.
Peg Samples again. On the topic of this infographic, have you approached not just Shields, but the rest of the gun dealers, the kind of retail outlets here in town, to ask if they might be able to put this in the package whenever they sell a gun? I mean, it's free to them, and it seems like it wouldn't be any hardship for them to distribute it, so it's just an idea.
I know on my desk at work I have a post-it note, and this conversation about Be Smart came up, and I think I'm looking at Roy because I think it was a conversation that we had, and knowing this presentation was coming. Is there anything, Roy, that you want to add that we're missing? Okay. I just don't want to later on think, oh, I should have asked Roy. So we gave some suggestions. Is there anything else that we can do as a commission to support you?
We have lots of follow-ups here, so I certainly appreciate that. And you have our contact information. We stand ready and willing to show up for events, to do presentations. So we look forward to hearing from you. If you are, sounds like supportive of moving forward, what our next steps would be.
Awesome. Thank you.
Thank you so much.
And if there's anything down the road, you can always hear you in public comment. All right, we are going to close item 2.02 and move on to 2.03, which is a presentation and discussion of the school safety audit process driven by Washoe County School District Emergency Services, including a summary of audits completed to date and plans for future reviews. I'm going to turn it over to Mr. Roy Anderson. But prior to that, I want everybody to know on the commission that this was a heavily talked about topic in September and October. And so I have invited Mr. Anderson to give us a high-level overview of the process that him and Michael Perry undergo in these safety audits. Mr. Anderson.
Thank you, Chair and Commission. Roy Anderson, Emergency Manager. So just going to do just a quick presentation for you, so you can have an understanding of what it is that we are doing with our audits and our assessments of our schools. So a couple legislative sessions ago, the NRS 388.910 was added, and it talks specifically about a school safety specialist being added to the district. because of our size and the needs that we have in our schools, the district created a school safety specialist position, and in 2019, right? 2020? Yeah, 2020. Yeah, it was literally, I think, a week before we went out for COVID. Perry started with the district, and part of what he does is an annual audit of school, and he does their risk assessments. And then obviously, due to the size of the district, he averages about 30 schools per year. So I'm going to turn it over to Perry so he just kind of walks you through what the process is and what it is that we are looking at when he does his assessments.
How's everybody doing today? My name is Michael Perry. I go by Perry, so if you see me out in public and you're screaming Michael, I'm not ignoring you. I haven't been called by my first name since probably kindergarten. When I came across, one of the things that was missing was a true tool. There's all kinds of nationwide tools out there for assessing everything from safety and security and just about anything you can think of. So this is the one time that I can say thank you, COVID, because I was able to take my laptop and do a ton of research. And what I did was I created a 7-section assessment based on reports from the School Safety Advocacy Councils, Department of Homeland Security, Department of Justice, the FBI, cyber infrastructure and security agencies, and based on my past experience in security and safety, and generated this. So, go ahead, next slide. The benefits of what was happening in the past is we were outside contracting someone to come in and do assessments. Their assessments were very targeted. My assessment covers the entire gambit from walking onto that campus to watching kids get dropped off in the morning to getting picked up in the afternoon to whether or not we have anti-bullying posters on our walls. That kept it to us, and it also allowed me to meet with school counseling, school psychologists, civil rights and compliance, student health services, and I partner with Safe Routes to School because understanding traffic management and flow and how it should look and what looks safe and what doesn't look safe. And I will knock on wood because it's one of my hang-ups. If you're in traffic, you better be in a safety vest. And that's one of the things that was missing, that message. So in combination of meeting with all these different departments and then asking them, I'm out there, what do you want me to look at? What do you want me to see? Because they can't go to all 102 schools plus the new one that we got coming up, 103, plus 9 sponsored charters, and make these attempts. So they gave me a series of questions as well, and that information is then fed back to those departments for them to take action on whatever's found positive or delta. Delta being negative, I don't like the word negative. Delta allows us to do better. Next slide. As I mentioned, the assessment itself is broke out into 7 separate sections. Campus and grounds, the exterior signage, school buildings, safety and security procedures, emergency response plans, the physical climate of the school, and then I generate a threat hazard identification and risk assessment which says, this is where your school is, 1 mile radius around your school, I'm going to tell you what hazards are there. Now, I'm not going to tell you what to do with those hazards or what to do with it, but you know what? The more that you're aware of what the threats are, and I'll use just a prime example. If you're sitting in a floodplain, what's your evacuation plan if you have a flood? So we're trying to bring that awareness to the table by doing these assessments. Next one. First one is campus grounds. So I look at everything from the perimeter fencing to the driveways, parking lots, sidewalks, the mechanical systems, are they exterior, are they interior, building identification. It's easy to identify a school. I know what a school looks like. However, if the address to the property is not out there for somebody else to find, how many schools do we have in general areas? I may not know the exact name. Oh, it's at the elementary school. Well, there's 3 of them. Which one? So those things that we hold very sacred as far as your address should be visible on your home, because emergency services got to go to your home. That same thought process. I look at video coverage. Do they have a camera system and what does it cover? Landscaping. We all want everything to look pretty when we want it to look pretty. But does it also meet SEPTAD environment where it is safe to have that big bush in front of your window where you can't see the front door? Not necessarily. So those are advisements based on the assessment. I also look at flood and earthquake mitigations. A lot of people don't know that Nevada is the third most earthquake-prone state in the United States. So if we have a bunch of rickety shelves with heavy stuff stacked on top of them, I'm going to note it and I'm going to inform on it. Next slide. The next one is section 2, which is exterior signage. This is pretty poignant. These are the signs that should be on a campus, displayed properly on a campus, to not only advise, but how many people have walked onto a campus, they know they got to check into the main office, but there's no directional area to tell you where's the thing. So those are the things that I advise. Hey, you should have a sign out there. I make note of that, put it in there. The other thing are restricted areas. What are restricted areas? There should be a sign on a boiler room door or a high voltage room that says it's restricted and you shouldn't be in there. Next one. The school building itself, do we have a controlled single point of entry? This one's relatively easy and everybody thinks, well, yeah, we've paid all this money, we've done all these things. If I walk onto a campus and the interior door of your controlled single point of entry is propped open, you've kind of defeated the purpose for what we spent money on. So I'll make note of those. Doors and windows. All exterior doors should be closed when I arrive on campus, said, except for the main door into the CSPE. I'm sneaky, so I will try and breach campuses because it's not that I want to do it as a security weakness to just, oh, I'm going to point my finger in you and say I can get in there. It's to go, if I can get in, who else can get in, right? And it's not just during operational hours. If your school doesn't start till 9 and I get there at 7 and I can walk onto your campus, we have an issue. We have a concern. So I convey that information as well. So I look at CCTV again, make sure that they have, after meeting with Student Health Services, meeting to make sure that we have AEDs. And do you know where your AED is? Do you know where your bleeding control kit is if you have them? Do you know where your EpiPens are stored? So that means that I'm also talking to the clinicians that are there as well. Next one.
Before we move on, can you just tell us what CCTV stands for?
Closed circuit TV, camera systems.
Okay, thank you.
And I'm going to go grab my water because I'm starting. I apologize for that. So we know that our elementary schools, almost all of them have one camera, and that's in the controlled single point of entry. DOJ and a lot of other facilities have said, you know what, you should have perimeter cameras to allow. So these are the things that I help identify between the school and with facilities and everybody else. Was that good?
Yes, thank you.
Okay. On section 4, I looked at the safety and security procedures, right? Administrative presence on campus. If I pull up to campus, because I always get there early, is administration out and walking around? As kids are arriving, are they engaging? Do they see that sense of, if I'm a parent and I'm dropping off my child, do I feel I dropped off my child at a building? Or I dropped it off to somebody who's there to take care of them while I did. That's one of those things. Student safety programs with mental health, Safe Voice, Secret Witness, I look for all those posters, signage, anything that's there that's associated with it. I check radio operations. What kind of coverage do I have? Yes, you have a radio, but if I go outside your building, can I be heard if I'm inside your building? So I check those things. And student policies, any of the student policies that are out there that I've been asked to review. And then general administrative plans. Do we have plans in place? Next one. This one is up Roy's alley right here. I make sure that they have current versions of the EOP, which is the Emergency Response Plan. Do you actually have an emergency response plan that's dated for that school year, or is it from 3 years ago, but you keep telling us you have one because changes get made? So has training occurred on it? That's a big question. It's not just a big book that sits on a shelf. Have you actually conducted training associated with the EOP? And that's everything from our normal drills, our code drills, and our red drills. I also partner with Safe Routes to School to find out, do they have a program? Do they not have a program? Do they have a safety committee in place, which helps identify those issues that are on campus and partners with Safe Routes to School? If they do not, then again, I liaison with them because I've talked to them and I give them that name, that contact, so they can go out and they can take care of that part. Next one. The physical climate of the school. This one's kind of big on me because I like the idea of pulling up to something that gives me pride, When you walk into the building, what are there 20% of the student work that's down the hallway? Do we have inspirational messages that are there? It's not a, yeah, you don't, so you're criticized. It's a, hey, can you consider this? It's something that says, I've taken a look and this is how I feel. I also feed that information right up to the mental health services and everybody else to say, hey, these are the programs I saw. Programs were really big because I go in and I use acronyms. Because I think if we've had the training in something, the minute I use an acronym, they'll identify with what the acronym is. If I got to explain the acronym, then it's a note that I send to that group to say, hey, they didn't recognize this. You might want to go back out there or touch or train or whatever else so they're aware of it. I look at student well-being. I look to make sure that staff mentoring is there, but not just staff mentoring. Do they have peer-to-peer mentoring programs? Maybe not a formal program, but do they have something that kids can relate to kids, if we want to put it that way? And then the district's threat assessment process. I ask very poignant, specific questions associated with that. Do you know what the program is? Who leads the assessment? Who looks at this? Who looks at that? And those are sit-down conversations. Next one. Then this is, like I said, Section 7. I take the school, I look at a 1 mile radius of that campus, and using GIS, using Google, using my access to rail line, my access to pipeline, my access to earthquake, my access to flood mapping, I provide a circular motion that says these are all the threats in your area. Considerations could be done. It's how you're looking. This partners directly kind of with Roy's world with the emergency management. Because in the emergency operations plan, there's 2 blank spaces for you to write in threats. I'm giving them to you. So those are those things that provide that information. We all know there's a tank farm in Sparks. We all know there's rail lines in the city of Reno, Sparks, and out in our rurals. There's a lot of people don't realize that there's spurs for the rail line that get used every once in a while, but you don't think they ever get used. So are you cognitive of those things? Or commercial storage of hazardous material. Out in the Stead area, we got people that store chlorine in large vats. If you're a school that's out in that area, you're aware of it. You know, I'm not saying you need to generate all this stuff for it, but do you have an awareness? Because if you have an awareness, you're able to respond effectively and or mitigate a threat. Next one. Once I complete the actual assessment itself, I create what's called a detailed confidential summary report. That detailed confidential summary report goes directly towards the principals, so they have access to the information, and to the organizations that ask specific questions, they get the bulk of what was found in those general areas. Next one. SSAC, when they were the third-party contractor, we can see what the numbers are. I'm not going to go over them. They had an entire team of it. I came in 2020. We went into lockdown, so that year was really hard to kind of hit as many schools as I want because I have to see students in the school. If I'm only seeing half your student load, wow, look how great it looks. So I want to see 600 kids at a school because I want to see what the confusion and everything else. Since I started it, I've basically completed 11 the first year, 34 last year, and thus so far I've done 10, and I got 10 more scheduled. This gives all those principals that opportunity to make those changes, facilities to coordinate or possibly prioritize projects, stuff like that. Next slide.
So the findings are separated into 3 levels. Basically, when Perry meets with the school administrator, there's things that, hey, you know, you're propping this door out, gates are not locked during school hours. So those are the kinds of things that we can address, immediately at the school level. Then there's other items that, if there's maybe signs that are missing, or maybe there's areas of the school where the public address system doesn't work or the intercom doesn't work, those are work orders that can be put in. And then other things, go to a larger kind of aspect and where there's going to be more of an interaction with capital projects. So we try to share those findings with the agency in the area that can have the most effect on working with them. And with that, we'll wrap it up, see if you have any questions.
I think it's important for the commission to maybe hear from Mr. Anderson why these findings aren't public and why you're not presenting specific findings on the central office today.
Yeah, so absolutely. So there's a couple things. Number one, obviously, is best practices. We're not going to say, oh, wait, we have this, weakness, this, vulnerability, at these locations. Number two is it's also protected by NRS. So specifically, NRS dictates that it is not public information that we share. So that's why we try to give you generalities of what we're looking at and what we look for. And then, with the understanding of we do address them as best we can internally, as soon as we are able to.
Thank you. Commissioner Porter, you were leaning in.
I had a very similar question, but just to piggyback on that, because you said the principals have access, and then you said certain people, I didn't quite catch who else has access, and just so I can understand that since they're not public.
So like we were making the bets that was there to say, if it's a capital project reference thing, say I have a problem on a playground that's common in 42 of my elementary schools. Capital Projects is going to get the buildup of this information from every one of the elementary schools that I'm going to, and then they can take it and prioritize it based on how they can do the work order, where the funding can come from, and everything else. I'm a data seeker, and I provide the data to those specific agencies so they know. Student health services or mental health services, the series of questions that they asked me to check for really drives them to build on their professional learning development days and everything else to make sure that they hit those. So that's how that information conveys out. It's the complexity of the report and how much information is in there that it ended up being protected under the NRS.
So to kind of answer a little bit, better with a detail or an example is, let's say the Safe to Tell, right? We're supposed to have like posters and signs at different locations. Well, that's not our department. We're not in charge of saying, hey, make sure you have your posters, but we can say you don't have it and then work with counseling to say, hey, these schools don't have those posters. Can you work on getting them out there?
So in those cases, would you give redacted reports then that just has their section that's relevant to them? Okay.
That is
got it.
correct.
Okay.
Any other questions or comments? Commissioner Bybee.
Charlene Bybee for the record. So when you finish the assessment and whether it just goes to the principal or capital projects, whatever, are they a mandated change that needs to happen? Is there some teeth in? Obviously, we want everything to be as safe as we can. So, and you're doing a tremendous amount of work at every school to do that. So what is the step on enforcement of the findings that you have and kind of a timeline on how you institute those changes?
Sure. Unfortunately, there's not like teeth like saying, this has to be fixed, this has to be fixed. So what we do is we create, or Perry creates what we call areas of possible improvements. So these are areas that you can address, you as the administration, right, can address these issues now based on personnel, based on roles and functions and how you actually operate the school. Then there's other things that you can put this in as for work orders. And usually those items are things that are done, day to day or as standard operating procedures. Some of the larger things like, if let's say there's large cracks in the playground, some of those have to go through the capital projects and maintenance kind of work. So those are a little bit higher. It takes longer process, but it's more of a awareness that this is occurring at these campuses for capital projects.
And I think as a comfort factor, I know the direction you're going because there's a difference between a recommendation and an area of possible improvement. Because an area of possible improvement's consideration, recommendation means you're going to get it done. I'm tenactic. So when I generate my reports and I find them, I go back to schools, even after I generate my report on a simple swinging in, I won't say drive-by, just swinging in and going, that back door, I found that open twice. So I'm going to go back by the school and I'm going to see, I got a lovely little notebook, I keep everything. So I'll go back in there and then I'll talk to administration and we'll have the conversation again. I've had 3 schools now that they've yet to catch me again, so I'm really happy. And then with the meetings that we sit in on, with capital projects, with mental health services, with our partnership, I train, I teach with student health services, so a lot of information. It becomes a community of communication. So it's constantly brought up as subject. Or if we're looking at, hey, look, we're looking to spend some money at the end of the year, got a list for you. let's start working. So that's where that power comes from. It comes from that constant level of communication and not just reporting on something and letting something say it was reported on. So, and that was also pulling together all these groups to understand we have an environment that's a bigger picture than one direction. So it's constantly bringing that information to the forefront, if that helps.
It does. And follow up, if I may, Mr. Chair. So I'm curious on some of the, is it district-wide policy, I would hope, some issues like exterior doors being locked, classroom doors, and I'm highly sensitive to the classroom door thing. I think the Uvalde situation was doors. We talk about a lot about the exterior doors. Do we have that whole list of Washoe County School District policy in place of the safety things that we know should be happening that you're finding, like a back door propped open, but are all the others interior doors? And there's probably a whole lot more set in policy. So those are things that the schools are responsible for making sure are happening.
So for individual classroom doors, there is not a district policy for that. Only the Board of Trustees can enact that district policy. There was an email that went out after Uvalde, so towards the end of the school year last year, where the superintendent did mention that it was highly recommended through school police that all classroom doors are kept shut and locked. Whenever we make contact and we go out to the schools, that's always one of the things that we always bring up is, number one way of being safe is being behind a locked door. So if you already have your classroom door shut and locked, you're already, that's the first step when you look at, code yellow response, code red response, is getting that door locked. So there isn't anything in place. If that's a recommendation, that could be made, that's a recommendation that could be made from, this body, of course, but as of right now, there is not a district policy for that.
Thank you. Any other commissioners?
No, Chair.
Thank you. Well, thank you, Mr. Anderson, Mr. Perry. I appreciate your time.
Thank you for the opportunity.
With that, we're going to close item 2.03 and move to our final item under section 2, which is 2.07, discussion and possible action to determine content, logistics, and marketing for the 2023 Washoe County School District Annual Safety Forum. And with this, I'm going to open it up to the commission. Prior to that, I'll ask for any public comment on this item.
No public comment.
Thank you. So I think today what I want to leave with is, one, a date of our safety forum. I know that we have historically utilized our marketing team, so if I can invite Megan up for some conversation around a date. We did decide that it would be held in May this year, but pinpoint a date, and then also pinpoint the topics that we want. I know one of the action items in a previous meeting is we wanted to extend it 15 minutes so that we had more time for question and answers, and that was approved, so it would be an hour and 15 minutes. And then also the time frame, like, do we want to do the time that we did last year, which was 7 a.m., noon, and 5 p.m., so that we can attract a more targeted audience at different times throughout the day, or if we wanted it to limit it to a different style or different option. Megan, if you have some dates that work best for the school district in May that you could throw out to us, I think that would be helpful. And then I will turn it back over to the commission for.
Great. Typically what we've learned is that, excuse me, that Wednesday, Thursday are usually the best dates for us, simply because our board meetings are on Tuesday, so that always presents a large conflict, even though those are only a couple times. So we were looking potentially at the, let's see, 10th or 11th, or the 17th. Yes, I'm looking at May. Perhaps the 24th. So any of those dates in there would be advisable. It's a very large district. There's always a slight conflict, but we'll try to accommodate as best we can.
Awesome. Thank you, Megan. Is there any date that she gave us, the 10th, the 11th, 17th, or 24th, that stands out as a day? Misty, I'm going to look at you, Commissioner Von Allen, for I know that it's Mental Health Awareness Month. Is there a day in there that is recognized so that we avoid conflict there? I know historically we've done it the second week of May, and I don't know if that was just precedence that was set prior to.
Misty Allen, for the record, typically Youth Mental Health Awareness Day is the first week.
Okay.
And I want to say the Thursday, so I'll look it up. But those Wednesdays all are good at this point. I'll look on the legislative calendar.
And one of the reasons we had typically avoided the first week of May is it's Educator Appreciation Week. So we typically have a lot of district activities happening during that week.
Awesome. Commissioner Porter.
Is it better then, Commissioner Von Allen, to piggyback, you think, on that mental health week, if that's that first week in May, to have that conversation continue going with, like, as soon as possible? So maybe that 10th is probably ideal? Yeah. That would be my recommendation.
You want to make that in the form of a motion?
Go ahead. You go
I
first.
was just going to add, this is Commissioner Lawrence, May 11th of 2023 is National Children's Mental Health Awareness Day. I can't look at two things at one time, so. And that's a Thursday, actually.
Can I make a motion then?
Absolutely.
Commissioner Porter for the record, and I'll make a motion to have the safety forum be held on May 11th, 2023.
I have a motion from Commissioner Porter. Is there a second?
Commissioner Lawrence seconding that motion?
Thank you, Commissioner Lawrence. With that, I'm going to open it up for discussion.
Thank you. I just wanted to add, Misty Allen, the Children's Week at the legislature is in March 13th to 16th. So just wanted to, I don't know if there's going to be activities that same week, but nationally it is recognized. So we're probably free and clear.
Awesome. Thank you for that feedback. Any other discussion? With that, we have a motion from Commissioner Porter, a second from Commissioner Lawrence. All those in favor, please signify by saying aye.
Aye.
Aye. Any opposed? Motion carries unanimously. So we have a date set. That gives us a target goal of what we're working towards. I know historically we've had some conversation. If we can pinpoint the topics that we would like, just so that it gives me and our vice chair some action item to work towards with our amazing marketing team, and also securing the subject matter experts within our community. Commissioner Porter.
Can we go back just to the times? I really like that idea of the 3 times. I think that makes it really helpful for as many people to be involved as possible. So do you need a motion on the 7, 12, and 5, or just the date and we can go from
I
there?
would like the motion on the times as well. That'd be
Okay.
great.
Before I do that, is 5 usually pretty well attended, or would 5:30 be better for people who are getting off work?
It's typically a little bit better, yeah, to give folks time to get home.
To do a 5:30?
Yes.
Okay. Okay. Perfect.
And if you could clarify on that, if you're talking physical and virtual components of each of the 3 offerings.
I was trying to read through previous minutes if we decided this year would be the online model, and then we would look at going next year to it in person. But that, again, I think is up to the commission. If we want to do the virtual ones in the morning and the afternoon and then do a physical location, we can do that for the 5:30, whatever the pleasure of the commission is.
This is Commissioner Porter for the record. Is there any drawback to doing a hybrid model for all 3? I mean, from a capacity standpoint, to where you could do virtual and in person?
We would need to think about location. Those morning and midday is a struggle because a lot of our school locations would be otherwise in use.
Okay.
So if we were to do a hybrid, it'd probably be the best option for the evening one.
Okay.
Commissioner Bybee.
Charlene Bybee for the record. Having done these many times and really worked hard on the physical location pre-pandemic, when we were all working hard, bringing incredible panels. Spanish Springs High School comes to mind. I mean, phenomenal, and a handful of people. Parents are just, and families are super busy, whether they're just getting off work, they've got more than one job, they've got kids playing baseball or sports, or it's just, as much as I like the in-person and that human connection you have, I've just found our numbers, and you've got all the data there, with the virtual gave people just to take an hour to get on, to get onto the virtual presentation, and then it's online, so you can go watch it. But we really drew more people in because most people can find with 3 options during the day. They can get on the computer, like Zoom meetings. I'm thankful still some are Zoom because then I can fit it in to a very busy schedule. So as much as I love the in-person, it's so much work, and we haven't had in the past good reward for that. So I'm really inclined to try another year of the virtual and see where we go, because it's tough, and parents aren't. And somebody told me at Spanish Springs, because some of those presenters were actually teachers when my kids were in school, and they said, you know what, Charlene, we're not getting the parents that you all showed up when you had your kids in school and you had PTA groups that came out for certain things in good numbers. She said, we're not seeing that now. We're just not.
And I think hearing what Commissioner Bybee is saying, if we plan for these to be in person or however we plan for this, next year we can really get with those PTA groups, and we can get with the groups that, the community members that we really want to get engaged. And I think our target audience are parents, so why not? I think we are so far ahead of the game than where we've been in the past that this is going to be a continuous item of discussion. So we can, after this forum's done, we can plan the date and get it out to PTA groups and say, save the date, and whatever that looks like. I also know historically, and I looked at Commissioner Allen and Bybee, we've done these on Saturday. And I don't think the response was any better when we were up at TMCC. The target audience showed up about 60, 70 people. I will say once we did go in person, we saw over 200 people day of. That's not who is watching that videos after. So we never know the potential of who we're impacting with these safety forums, except for the tangible data that we have the day of.
Commissioner Porter, for the record, it would be helpful to know when you did them in person in the past, because I haven't been on this committee as long as you guys have, or this commission. Were there multiple locations or just a single location? Just a single location. So that makes it really hard if you're not in that neighborhood, and especially being a parent representative. We have so many activities. It's crazy.
And I will say that we have we have rotated. Then we were at TMCC and then Spanish Springs, and then we were at an elementary school, and we were at Hug for 1 year. So we've done them in different locations.
But it's only one location per
per
the
year.
day for that year. Yeah.
If I could interject, so I began this job about 7 years ago, and that year that I had started, it was rotating. That's when Lisa Ruggiero was chair of the committee, and those were actually worse turnout than the ones we've had at individual locations. The successful one I do recall was, I think you might remember, at Maxwell Elementary. That had a good turnout. We were real selective on the topics, and then it was more interactive. It wasn't just you learning from the expert. It was parents giving feedback about, say, communication policies or security. They were having more interactive conversations with the folks involved in those, and giving their feedback. And the cool part about that is, at least from our department standpoint, we were able to sort of interject those into sort of our communications protocols or whatever the feedback might be. So that was one format that worked.
Commissioner Von Allen.
Thank you, Megan, for that feedback. It really sparked my interest having the hybrid with the morning and noon virtual and then the face-to-face, because that was wonderful. Parents and teachers chose to come and interact, and then we presented on those conversations. And I do miss that, because the virtual, you're not getting the back and forth at all.
I think that's the one thing that we struggled with as a commission. We did a short survey afterwards, and the interaction is really what we as a commission want for the targeted audience when they're there asking questions. And I mean, we've all attended enough Zoom meetings that it's uncomfortable and it's weird and it's awkward to ask a question to somebody. You don't know when to chime in and when not to. And also I think it poses a great opportunity for us to engage parents that don't have means to access technology. Like, we're forgetting about the parents that don't have means to really access technology. We're asking a lot of them to find a way to attend our safety forum with no means to provide it. But then it also poses, where do we hold it? Because means of transportation could be an issue.
So do you need a motion for the times and the hybrid? Or
I
is
would
that
like
for
one,
further
yes.
discussion?
Yes.
Okay. Just based on the feedback, it was super helpful to have that background information. I would propose a motion that we hold a 7 a.m. and a 12 p.m. virtual safety forum and a 5:30 p.m. hybrid model where it's in-person and virtual options for the 2023 safety forum.
Thank you, Commissioner Porter.
This is Commissioner Allen. I would second that motion.
Thank you, Commissioner Allen. Is there any discussion? All right, with that motion and second, yes, Commissioner
Sorry.
Bybee.
Mr. Chair, Charlene Bybee for the record. And I do like the in-person. So much frustration when you just can't get people there. So obviously the location's going to be critical of where do we think the most amount of people would come. You know, I'm clear out in Sparks or Egypt, as my boys used to say. And then you've got so many different corners geographically, what would be most central, and maybe 5:30 would be tight for people coming off work. So is 5:30 an optimal time for someone to pick up their kids or whatever, grab dinner for the kids I mean, I'm just thinking logistics. Is 5:30 another challenge for people to get there compared to doing them a little bit later? I don't know, 6 is ideal or 6:30 to allow people time to get kids home fed and then you there to the event. Just a thought. I'll kind of see what everybody else feels.
Yeah, thank you. I think what we can do is approve the times, or we can re-amend the motion should the motioner decide to. And that will give me and Megan the opportunity to look at where, now that we have the date and the time, what locations are available within the school district, and then given that time frame, can we host it any location that is centralized to the majority of the population we're seeking to target. So I'm looking at Commissioner Porter if you would like to continue the conversation about the times for the evening one, or if you're satisfied with your motion and we vote on it.
I am satisfied with the motion simply because what I've seen too with events, especially for parents, if you push it to 6:30, 7, they're home and they're stay home. Whereas if you can get them in that commute window, yes, you might get kids a little, later dinner, or dad might take kids and mom goes to the safety forum or whatever ends up being the case. But if you push it out, it's harder to get people back out and re-engaged. So that makes me nervous. So I would like to keep it at 5:30.
Thank you. Any other discussion? All right, with that, we'll take a vote. The motion that we have is that we propose 7 a.m. and 12 p.m. virtual on May 11th, and a 5:30 option as a hybrid. All those in favor, please signify by saying aye.
Aye.
Aye. Any opposed? Motion carries. Thank you so much for that. Now we can talk about topics. I think that gives us some direction. I will work with Megan and find a central location or locations, and then we can come back and vote on it at our March 6th meeting.
Ms. Allen, in light of the Be Smart that we saw 20 minutes, it's a perfect size. We cannot have enough of those conversations, so I would recommend them. Sorry, I've lost my words. The Be Smart group to come and present.
And as we are talking about this, I'll give you some historical data. We've had historically 4 different topics at each safety forum. They're the same topics at all 3 forums. Is that the style that we want to go with? Is 4 topics, and then we divided it last year into 2 sessions. So topic A and topic B, you had the option to go to either one of those, and then topic C and topic D were 20 minutes later. And then if you were passionate about a certain topic, you could attend another session to get more than 2 topics in. But typically with the 4 sessions, any visitor to our safety forum would get 2 topics, one at the proposed time of section A and B, and then session C and D. And I think what we have done in the past is strategically placed the topics so that they weren't like topics, or I don't want to say competing topics, but they were vastly different, so you were hitting a different target audience.
Chair, can I clarify? I thought you said we're looking at an hour and 15 minutes instead of an hour this time. So how long would each session be?
That's really up to us. What we did last safety forum and the previous was there was a opening remarks of 10 to 15 minutes between the superintendent and I. And then we did the introductions of the sessions and breakout sessions. And I think 25 minutes is what we targeted at our last conversation. So that would be the 50 minutes and then 15 minutes as follow-up. We'll have all the panelists in one room, all 4 panelists in one room with all the audience, so they have the opportunity to ask questions. I know some of the topics that I sat in on and was the moderator, the moderators or the presenters used all 20 minutes that we had, and there was no room for questions and answers. So we as a commission decided to open it up 15 minutes more so that there was welcome back from your sessions, and the presenters are here, and what are your questions that you may have for them?
Okay, so 25 minutes per topic. Okay, thank you.
So I like the direction that Commissioner Von Allen is going with Be Smart. I think it's, again, I don't want to ever put Misty on the spot, but suicide, we can't talk about suicide enough. So I think the 2 topics together, I think, will pair well. And Misty is the expert in her conversation, and I'm sure she can share her time wisely with Be Smart and coordinate that if I can put you on the spot.
Yeah, thank you, Chair. We are developing with our Youth Suicide Prevention Coordinator at Emma White a safe messaging program. So it's people with lived experience and sharing their stories in a safe way, but also media, social media, that well-being with social media. So I feel that that might be close enough, but unique for the audience if they have been there in the past forums.
Awesome.
But I just proposed that to the group if that is of interest.
Yeah, awesome. Thank you. Commissioner Porter.
Can I just get clarification on the breakout? So there's 4 topics, and then you can choose which you go to. So not everybody wouldn't hear all of the presentations, correct?
So there's 4 topics. They would hear
Okay.
topic A and topic B playing at the same time, and they decide which breakout room they want to go to, and then topic C and topic D, they would decide.
Okay.
Again, the unique thing is later on they can go back and watch if they were really passionate about the suicide prevention, but there was something that at the same time they can go back after their live videos or post it onto our website, school district's website.
Okay, thank you. Would it also be worth, just based on the presentation we had today, having a section around the physical safety of the buildings and the closed doors, or anything that parents are noticing or seeing, or teachers and staff are noticing that they would like to see as a larger district policy versus a recommendation?
It's up to us as a commission what we decide.
Okay.
Yeah. I think one of the topics that really is near and dear to my heart that I would like to continue to have the conversation is sex trafficking and how it affects our youth. And I know that we last year had the regional unit of sex trafficking really did a great presentation, but continuing that conversation and educating the community on what it really is.
Mr. Chair, Charlene Bybee for the record. Didn't we also do one last year on fentanyl and drug awareness session that, especially with the fentanyl issues right now, I don't think can be underscored what for parents, especially to really, and grandparents to really kind of understand that fentanyl is number one, but the drug awareness, what did we call that last year? It was incorporated. It was, I think it focused on fentanyl, but a drug awareness and information for parents. I think that was, yeah, but I mean, we did, could be drug and alcohol. Could be drug and alcohol awareness.
And maybe we lean on our
information.
law enforcement team. I'm looking at Commissioner Flores being in the juvenile justice system, but what are some trends in our community? Maybe it's not just sex trafficking. Maybe we have 3 of our hardest hit topics, and we have that presented, and I think drug overdose and awareness is one of them. I would be certain that it's there.
Commissioner Flores, for the record, everything that's been brought up, suicide, firearm safety, sex trafficking, we call it human trafficking, opioid use, and all of those things are relevant, and definitely I would say, we can speak, I definitely could provide support for the trends that we're seeing in our community related to how those intersect in juvenile justice. I'd only be able to speak to, those instances that come to our attention, but all of these are relevant, I can't think of any one of these that wouldn't be pertinent for a parent to know in our community right now. And I certainly, from a juvenile justice standpoint, can provide any supporting information and even subject matter experts to some degree. And if I don't have any, like, for example, substance use, we don't have, we don't provide the clinical care. But we certainly can speak from our perspective related to, the impact it has in the community from a delinquency standpoint.
Thank you. The other thing that really is hitting home, for me as a parent, is not just the physical safeties of schools, but the physical safeties of getting to school and our traffic accidents and where we're at. And I think it's important for maybe parents to hear the message that physical safety starts with us as parents at home and how we can continue that conversation. I know we've had before us several of the administrators and counselors that have been involved in some of the physical pedestrian versus vehicle accidents. So I certainly can lean on them as some experts, but I think that is a topic of well-needed discussion as well. Sadly, our fatalities are not going down. I want to say they're not going up either, but I think the more important thing is the topics that we talk about at our safety forum are topics that parents can continue to have the conversations with after we leave and want more information. It's not just a one and done. And like you said, Commissioner Flores, these are all relevant topics. Last year we did a lot around mental health. Not that mental health should be avoided this year, but I think Be Smart and suicide is a big mental health component. And then also I wrote down trends in our juveniles and what we're seeing in the community as a topic so that it hits a various we're not just broadening, or we're not limiting it to just one thing. We're broadening it to what the trends that we're seeing that are affecting our children. I see Commissioner Gogachia's hand up, so I'm going to call on her.
She is typing her question,
Thank
Chair.
you. Chair Benton, while we're
Yes.
waiting, I support Commissioner Porter's suggestion. I found today's topic with Roy and Perry's update. If there's a way to make that user-friendly for the parents, I thought it was wonderful. So that might be something to think about.
Awesome. So Commissioner Gogachia says, I am curious about having an actual naloxone training as part of the fentanyl awareness part. Naloxone. So naloxone is what is used to reverse a fentanyl overdose. And she continues to say this would allow parents and caregivers the understanding of where to access it and how it can be used safely. I can add that. Commissioner Gogachia, that's a great comment. Yes, please. I almost said Commissioner Loudon, but it's really Catherine Loudon, our school counseling director.
Hi, thank you very much, commissioners, for having me, and thank you for giving me a few minutes to speak. I actually am working with the principal of Sparks High School to have a fentanyl awareness and naloxone training for parents together with Join Together Northern Nevada and Quest Counseling and Consulting. So that doesn't mean that we shouldn't have layers of opportunities for parents and staff to hear more information, but that is something that we will be having in the next couple months. But I think that we critically need to have more of that in the community. I just wanted you to know and did not want to be sitting there listening to you plan that without you knowing that that's also something that we're looking at in the near future.
Thank you. And you have a response from Commissioner Gogachia, says that she thinks that is awesome, amazing.
Can I ask a question for?
Yes, Commissioner Porter.
Commissioner Porter, for the record, is this just at Sparks High School, or can anyone attend?
It will be open to the whole district.
Is it something that we could replicate for this, so that you could do that presentation in 2 areas or 2 places, or is it a longer, versus a 20-minute allotment?
We would need to talk to our partners,
Okay.
but I don't see any reason why we couldn't do it again.
Might
And,
as well.
we're also having a lot of issues with marijuana concentrates and the use of marijuana concentrates with our youth. And I'm looking at Liz, Commissioner Flores, because it's a chronic issue that we're all brainstorming as well and trying to address with our youth. So that could be another opportunity. I feel like as I listen to you, there are so many great ideas and so many essential topics It's so difficult to narrow them all down.
Sure. Okay, thank you.
And I think in the community, Joining Together Northern Nevada is great with the naloxone training. So I'm happy to hear that you're partnering with them. Just from experience, having gone through the training a few times, I think 25 minutes is a short time frame. For any of the presenters that we've had at my day job, they like to go over the data, the statistics, and the NRS behind the reason why naloxone is what it is and all of that. So I would be remiss if somebody had to shorten that to 25 minutes. They might miss some key components.
If I could just throw out one thing, which I think my colleague Chad Hartley mentioned at maybe your December meeting, but we had talked about the possibility of maybe recording some of these in advance. That way it's very tight for the presenters, but also it allows them more time for questions in the actual live session. So if we were to do a 20 minute recorded piece with them that plays, and then there's more time in the session for questions. Plus, there were some issues last year trying to get presentations, just trying to avoid some of those technical aspects or waiting for a presenter who might have got called to something else. It would avoid some of those just technical kinks.
Yeah, when I was reading through the minutes, I think one of the things that I really enjoyed was that piece, and also we can leave it up to the presenter to where they're comfortable. I mean, the messaging would be very different to hear Misty being recorded than her passion behind it day in and day out. Sorry, I'm using you as an example. But if there is a topic that the presenter feels comfortable recording, I think that would be appropriate.
Thank you, Mr. Chair. Charlene Bybee for the record. So where are we? We only have 4 topics, correct?
Correct.
We got to narrow down to 4, and this is hard. There's so many.
And we're 10 minutes over.
And we're 10 minutes over. So what topics do you have down? And I think we're going to have to do the best to choose what we think the top priority is, because we can't do them all.
Well, in the interest of time, I can repeat the topics and the 4 topics that I wrote down as a motion. I have Be Smart and suicide prevention as 1, physical safety of schools as the 2nd, trends in our juvenile justice system, and then I also wrote down the pedestrian versus vehicle accidents.
Chairman, may I clarify? Be Smart and suicide prevention are going to be in that 25-minute block?
Together, or we can separate them. You can say no to my motion. And
Okay. I would move that the Be Smart's about 20-minute presentation. I would feel that diminishes their message, so I would prefer they were separated.
So I'll look for a second to my motion. If it dies, then we can turn it over to you for a motion. Awesome. For lack of a second, that motion dies. I'm going to pass it over to you, Commissioner Von Allen.
This is Commissioner Flores, if I may.
Yes, absolutely.
Regarding the potential subject of juvenile justice trends, traffic is something that was on the agenda last time, and it is related to trends in juvenile justice.
Okay.
So I'm just making the comment that if indeed this group were to elect to move forward with juvenile justice trends, even though there's quite a few, traffic would fit under there.
Perfect.
And are we also not, you didn't say fentanyl or the drugs wasn't on your list?
I put that in the trends of the juvenile justice. That and human trafficking.
Oh, wow, that's a big one. Okay.
So instead of sending it over to...
Well, and Mr. Chair, kind of, when you said physical safety of schools, really when you talk, when he was doing all the auditing things, safe routes to school and that physical, that fall under the physical, it can be put maybe not under your juvenile, but maybe under the physical safety of schools would also include safe routes to school and pedestrian safety and an awareness of getting your kids to and from school and doing that safely if we want to do the physical safety. Because a lot of parents don't realize everything that we've done in the years that how many physical safety components, and we're not finished. But I think that's important for parents to know that piece. So I think in 25 minutes you could do that, and part of it would be your safe routes to school and your pedestrian safety component could be there.
Awesome. So I will restate a motion. We are going to have 4 different topics, one being Be Smart gun safety, second one being suicide prevention and awareness, another one being physical safety of schools, and then the final one being trends of our juvenile justice system. And leaving it as broad as it is, it will allow those subject matter experts to fill the gaps of what they think the information that should be presented. And we can certainly at our next meeting provide some nitty-gritty details of what we're looking for as a commission. So when we look for those experts, that we can say this is what our target audience we would like for them to hear. So that is my motion.
Commissioner Flores, I second that motion.
Thank you, Commissioner Flores. Is there any discussion? All those in favor, please signify by saying aye.
Aye.
Any opposed? Motion carries. Sylvia, did you get all of that? Thank you. All right. Is there any other discussion that we need to have around our safety forum? We have the date, we have the times, we have the style, and we have the topics.
Can I ask a clarifying question?
Absolutely.
Okay, so for the evening hybrid format, are we envisioning that be 4 different classrooms and then we come back together at the end? Just wanted to kind of get a feel of what that would look like for the group. And also just going to mention it's a physical location, so you could potentially add more if there were partner organizations, like kind of a symposium type, if people wanted to table in a central area or something.
Yeah, I think that is a great option. I think having the 2 breakout sessions for one time frame and then the other 2 at another time to style it the same as our hybrid so that we're not having to recreate the wheel and what that looks like would be fair. Commissioner Bybee?
I'm good.
Okay, your light's on, so I wasn't sure if you were leaning in.
I'm good.
All right. Well, with that, we're going to go to we're going to close item 2.07. And thank you for that great work. I think it's the meat of what we do here at the Commission. Closing items, public comment, 3.01.
We did receive public comment from Dennis Black, Chair.
Thank you. And with that, our next meeting is scheduled for March 6, 2023. And before I adjourn the meeting, I wanted to recognize Catherine Loudon and the Department of School Counseling. It is National School Counseling Week. And there is an article floating around that recognizes our Washoe County School District school counselors as some experts in the field. So thank you for the work that you do, Catherine. And with that, it's 4:16, and we will adjourn the meeting.